am Margaret Perez, and I work for public health. I am a health specialist, and I coordinate the SHIP grant. I'm part of a unique program. I'm part of the health promotion and planning team, and traditionally when you think about health promotion and planning, you are thinking about Zumba classes, wellness, yoga, eating well. What we do specifically for the grant that I coordinate is work with institutions, so usually the city, businesses in the community, schools, faith community, to work on creating healthier environments so that people can make healthy choices kind of by default. I honestly am still trying to figure out how I got into this field, but so I studied Latin American studies and economics in my undergrad, and I was really interested in agricultural trade on a global scale, and I spent some time studying abroad, and I interned with a fair trade organization and realized that a lot of sort of the global food injustices that exist kind of out there are really a result of the way that we produce and consume food here in the US. And so I came home from that international experience really focused on changing local food systems and increasing access to local and healthy foods here in my home state of Minnesota. I thought that, you know, if I can be here and I can work with people from all walks of life here, I can really make a large impact just in my own community, and that felt more meaningful to me than doing something abroad. And so I spent a lot of time working with in urban agriculture, and then I started working in food shelves, where I started coming more and more in contact with public health as they were trying to kind of impact healthy food access in the food shelf setting, so trying to increase the amount of fresh fruits and vegetables that were available to low-income people. And through that, I really realized that government and public health specifically was a really great way to help kind of shape and guide environments so that people, that all people could kind of have access to that healthy food. And kind of the rest is history. It's really rewarding work, but anything in public health is kind of what they call like a slow burn policy or a slow burn intervention, meaning that you do something now and the impacts happen later. Or better yet, if you do something now, you're avoiding something that would have happened that will never happen, like getting lung cancer. We were the first city in the state of Minnesota to pass the Clean Indoor Air Act, and we actually kind of created a ripple effect throughout the rest of the state. That was back in 2004 that we passed that. Bloomington has always been a leader when it comes to promoting tobacco-free environments. Recently, we were the third city in the state to increase the tobacco purchase age from 18 to 21. And you can actually see with each policy that has been passed that the youth tobacco initiation rate has gone down, and it's really cool to see that over a 20-year picture. And I think that we're just at the beginning of that in terms of our understanding of how to do that same thing that we've done with tobacco and tobacco use and initiation in the healthy food and physical activity realm. We directly impact the community by really shaping environments so that the healthy choice is the easy choice. I'm really excited about the future of Bloomington because I think that we're doing a lot of really good things to try and bring our work out into the community and trying to really target our programs and interventions, as we call them, in public health so that they're impacting the people that will most benefit from our services. I see a lot more community-oriented programming, a lot more community-driven programming. I think that that's really exciting because I think when community is part of the solution, that the ultimate solution is going to be much stronger and more impactful.